Hi, my name is Dr. Nitin. I'm the neurologist in Fortis Hospital, Cunningham Road. So today I would like to share some basic information about stroke. So what is stroke? Stroke is an acute neurological emergency, and if these patients are not treated, they can land up in a handicapped state, and it's going to be a burden to the society and to the family. So basically, how does a patient with stroke present? Stroke is a sudden or an acute presentation wherein the patient has sudden weakness of the limbs. It could be the lower limbs, the legs, the upper limbs, the hands. It could be a loss of speech, difficulty in speaking, or there could be a sudden loss of consciousness. So it's a sudden presentation of a neurological condition. And these patients, if they are not treated in time, they are bound to have a irreversible damage or a complete progressive weakness wherein the patient cannot recover. So identifying stroke is very important. Now, why does a stroke happen? The stroke happens because of a reduced or a disturbed blood flow to the brain. So reduced or disturbed blood flow to the brain means that either it could be a blockade in the blood flow in the form of a clot in the blood vessels, or it could be because of a bleeding in the brain. So there are two different scenarios where the stroke can happen, and the statistics says that around 85% of patients with stroke occur due to a clot in the blood flow to the brain. So we have to know that what are the scenarios wherein the patient can develop stroke. Generally, the patients with hypertension, diabetes, heart disease, these kind of patients with this kind of a background can have stroke in future. So controlling these medical conditions properly through regular checkups would be very useful. And this apart, smoking, alcohol, bad food habits, stressful lifestyle, no exercise, so these type of other risk factors could be a very important reason why the patients can develop stroke. It is generally said that stroke happens in patients who are elderly, above maybe 45 years and above. That's the usual age group where the stroke can happen. But what is alarming is that of late we have seen patients in younger age group, maybe less than 45. I have seen patients at the age of 25 to 30 coming with stroke, and that is something which is not acceptable. So what could be the reason? The reason could be maybe the lifestyle is like changing compared to what our predecessors few years back were. So it is important that these things should be kept in mind whenever we handle patients with stroke. So as I said, stroke is a acute neurological emergency. That means that these type of patients have to be brought to the hospital as early as possible. So as far as treatment is concerned for patients with stroke, the treatment for patients with stroke is available. That means to say, if the patient is brought into a center where there is a neurologist, where there is an emergency team, where there is radiology team who can do the scans and interpret, and physiotherapy team, if the patient is brought to this particular center in a particular time frame, the time frame is called as a window period or the golden period, and this is between 3 to 4 hours. So if the patient is brought within the first 4.5 hours, we can give specific treatment to these patients. It could be in the form of specific medications, or it could be some procedures wherein the clot in the brain is dissolved or it is removed and the blood flow to the brain is restored, and the patient will start recovering from the existing weakness. So the treatment is available. It's only that the patient should be brought to the hospital as early as possible. To summarize, a stroke is an acute neurological condition. It can happen to any individual with the risk factors. Presently, young individuals are also getting stroke, and there is treatment for stroke which is effective, but the patient has to be brought in as early as possible. The window period is very important, as I said, which is less than 4.5 hours. So I was just telling about the causes which can lead on to stroke, which included hypertension, diabetes, heart disease, or other risk factors like smoking, alcohol, bad food habits, stressful lifestyle, lack of exercises, and other habits. So these are all the usual causes which we look at which can cause stroke. So what can we do to prevent stroke? That's an important question. So as far as hypertension, diabetes, and the heart problem is concerned, most of it is like genetically coming. If the parents have got hypertension, diabetes, there's a tendency for even children to have these things. These may not be easily kind of changed except for the food habits. But what we can really change is the habits. Let's say smoking. So smoking is an important risk factor for stroke, even for heart disease, like heart attacks do happen in patients who smoke more frequently. So avoid smoking. Even alcohol is not a very good thing to take. Chronic alcoholics, we have seen quite a number of patients coming with heart problems. They can come with stroke, they can come with muscle problems and all. So even that is something which we can avoid. As far as food habits are concerned, I think we should cut short on those foods which have more of lipids or fats in them. Try to have more of vegetables, have more of sprouts, dry fruits. There are so many good foods which you can take. Even the non-vegetarian diet, I think you can avoid red meat like mutton, beef. These things could be avoided. If at all you want to take a non-vegetarian diet, I think fish is good, white meat like chicken is good, skin out. So these things should be followed. And even the junk foods, what the younger generation is after, these things could be definitely a big problem in future. I think we should avoid that also. And maintaining a proper diet interval, skipping meals can also be a problem. Having more calorie diet in the late evenings can also be a problem, because they go to deposit. They can again lead on to more of calories and deposition of fat in your system. So the food habits have to be kind of followed like this. And as far as exercise is concerned, exercise is a very important thing. The exercise, if it is done on a regular basis at a specific time period, I think you can burn your calories. We can bring down the fats, lipids in your system. That's going to increase the tone of your muscles, the tone of your heart muscles too. So it's good for the heart. If it is good for the heart, then obviously it's going to be good for the brain too. So exercise is very important. Now we have got the majority of youngsters are now in the IT sector or in a job which is not very laborious. Most of them are desk jobs. They sit in front of the system, so spend a lot of time with the system, and the day is over. So they're not, this is not going to tone up your muscles, including the heart muscles too. So it's as good as not exercising. So sedentary lifestyle is something which you should be very careful about, not to get into it too much. Just have some exercises in between, and you can have your own plan of doing the exercises, even your work schedule. So these are some basic things which you can do. Should be of help, to prevent these conditions.